So we're going to talk a bit about working with substance use problems, and you've got a case that we can use to think about that.
Yeah, sure. This is a man who's 38, and he is an only son, and he comes from a very permissive, very protective family. During his adolescence, he started to use cannabis and sometimes cocaine. Why? Because he had to manage his high level of social anxiety and feel like the others, feel he belonged to the others. After a while, out of fear that they would lose him, their family started to buy cannabis for him. His life went on like that, and he had to drop out of university. He couldn't find a long-term work, and he has not motivation to change, except that he came to the psychiatric ward because of a couple of violent outbursts. Now he comes to the psychotherapist saying, I understand I'm not too old to get a chance for my life.
So that's the crisis that has brought him to treatment or to think about change.
Yeah, the admission.
One of the problems is how to deal with that lack of motivation, how we try to motivate this patient to work through his drug addiction. One way is to do motivational interviewing and trying to promote a development of a state of change in the sense of Prochaska, and trying to initiate a work towards leaving the drugs. But which are the differences of working with motivational interviewing under a cognitive analytic perspective? And I think there are two main themes. One is the multiplicity of self, because when you say he is not motivated, under our perspective is who of you is not motivated, and who of you is going to be here with me finding the way of dealing with this. And also there is another topic in cognitive analytic therapy, just from the beginning in the motivational intervention, is that we understand the problems under a relational point of view. So you need to change to improve not only yourself, improve also the relationship with the others and with the world. So that's a way of working. What do you think?
Yeah, and I think we would often sort of understand a substance use problem, particularly in this example, the kind of mapping that we might end up doing with someone like this is to be thinking about his social anxiety, what's happening, and often the word we might end up with is judging and feeling not good enough or some version of that, and how, you know, trapped he is in feeling like his only way of feeling better is to escape, you know, these horrible, unbearable feelings. And one of the best ways we know to change how you feel is to take drugs or, you know, use substances. So it makes sense, and we can understand why he would choose to do that at the age of 16. And the sad thing about the story is that he's never really learned how to get out of that, and what he's ended up with is the vicious circle that he can't really get out of. And so we would be I guess in a simplistic way, you know, rather than just a motivational loop that isn't connected to the reciprocal role idea and the relational sort of origins, we'd be thinking about how do we use the relationship and how do we help him think about how he can get what he wants, which is relief from the overwhelming feelings.
Yeah.
But how does he do that in a different way?
Yeah, something that was used from the very beginning of cognitive analytic therapy was what we call the observing eye. And one of the characteristics of the people, the adolescent with drug addiction, is that observing eye, that usually we draw it in the corner of the sheet of paper, they don't use that observing eye. They only wish drug, take drug, feel in heaven, but don't observe anything more than that. So the cognitive analytic way of working is inviting the patient to increase and develop this observing eye to understand all those processes.
Absolutely. And so the actual process of mapping together, talking about the relationship and how we want to have something different from the judging and never good enough, and what would this be about?
Yeah.
How do you want to feel in a relationship, and how do I want to be, and what would we set up here? And that we can actually use that, and the process of developing that helps develop this.
Yeah.
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 For somebody who's never really been able to slow the process down and stop and think, and never been encouraged to really stop and think. Yeah.
Okay, well, how could I put all this into the room? Because, you know, this patient is 38, but he is very much stuck in that position he was when he started use drugs, in the adolescent position. He never had adulthood experiences. So what do you suggest me to do in the room with the patient?
Well, one thing we need to say is that obviously a patient that has been using drugs for 20 years, more or less, a few sessions of cognitive analytic therapy is not going to resolve that. We need to collaborate with other teams, and also in that collaboration there are different roles and different relationships with the patient and within the teams that need to be understood. So,
and it would be really important to think about, you know, whatever our responses are, that we don't just inadvertently reinforce the same patterns. So it sounds like his parents, for example, have tried really hard to be good parents, but somehow they're pulled into thinking that he can't do this on his own, that he's not capable. And, you know, they're very worried about him, but their way of managing that is to kind of baby him almost, isn't it? To take away his sense of autonomy and agency, and, you know, and in a way what they're doing is helping him escape the bad feelings that he has about himself, rather than building him up, you know, encouraging him to try things. And so the other roles of the other services that you might get involved would be to help him have real life experiences that start to give him a sense of achievement and confidence in himself. Because right now, it's a self-to-self kind of belief about himself not being able, and it's also reinforced by his parents. And we would have to be very careful we don't automatically think he can't do it either. And actually, even you know, now, while we're saying it's going to take a long time and we'll need lots of services, we have to be careful that even that doesn't inadvertently take away what he can do himself. So, you know, I think it's very easy to feel hopeless about it, But if we can be thinking, what is it that he actually does want out of his life? If we can find something that he's willing to work towards, and then we can be thinking, how do we continue to be encouraging and empowering and accepting when he makes mistakes, that we can model that in our relationship with him, but also help him be explicitly working towards some of that as opposed to just avoiding. Because the avoidance is what he's been doing all this time, which is very easy to avoid, isn't it? And it's hard to face what's scary. Mm. Have you got some other ideas?
No,
Yeah.
okay.
I wondered about your idea about the timeline.
Yeah.
Do you want to talk about that at all?
Yes. Also, another way of looking at this is looking to the timeline. Who were you when you were an adolescent before entering in taking drugs? And which different parts were inside you? How were you as a normal adolescent, 14 years old? And when does the drugs enter in your life and occupy a lot of your inner life, and there are only few other inner parts that you are managing your life in a healthy way? And where do you want to arrive? How can you imagine yourself in the future trying to diminish this drug addicted part inside you that is always looking for heaven? And if you take away this part of you, which other ones will grow inside you to be a new person? And I would like to go with you in this process. That's another way of working with this.
And if we went back to this cat diagram, or more traditional, you could be thinking, what are these? This is the way of drawing it as a reciprocal role, and these are more the self-state ideas.
Yes.
Yeah. So which are the parts of you, and then what would that look like reciprocally? Because I think we're both working towards the same thing.
Yes.
It's about how do you want to be in the world.
And also in this relational understanding of reciprocal roles, obviously you can look at it in the axis of time. How were you relationing with other people when you were an adolescent? And how are you doing right now? So the axis of time always is present because it's life.